Thank you everyone for joining Minnesota HIMSS today for our webinar presented by our friends at Optum Advisory Services. We will be recording this event and making this available to all of our Minnesota HIMSS members. If you would like to be a speaker or sponsor for a future webinar event, please reach out to us via our webpage at mn.himsschapter.org. We will do a Q&A at the end of the session. Please type any of your questions into the question section of GoToWebinar. I am pleased to introduce Mike Stack, who will introduce our speakers today. Mike lives in Minneapolis-St. Paul area and manages the Midwest region for Optum. Mike has been with Optum for the past 6 years, the first 3 leading the business development team for Optum's innovation organization, and the last 3 in his current role as VP of Sales. Prior to Optum, Mike led sales teams in the business-to-consumer marketplace, focusing on the healthcare payer market and specifically United Healthcare. Mike has a BS in accounting from the University of Wisconsin. Thank you, Mike, for kicking off our webinar today.
Thank you, Rebecca, and thanks to everybody who's joining, and specifically, let me call out a thanks to the speakers that we have here today. As everybody is aware, we're living through a pretty difficult time, both from a social responsibility as well as a medical and a COVID, the things that are going on with COVID. I was telling my wife, I think when it's all said and done, that 2020 will be a year that people read about in history books, and because it's sort of a year like no others. But one of the things that we have seen, and as Rebecca pointed out, I ran our business development for the innovation organization within Optum for 3 years, and that was 3 years ago, or actually 6 years ago I started doing that. And one of the things that we were seeing an awful lot of at that time was telehealth, televisits, video visits, digital health, remote patient monitoring, et cetera, and everything that goes along with it. And clearly the adoption at that point was marginal at best. Fast forward to 2020, to a COVID situation, to patient fears and patients not wanting to go to a place where they might have the potential for infection, and the whole COVID pandemic, and et cetera. And all of a sudden, we've seen an exponential growth in digital health. I've had organizations tell me that they went from a handful of visits a week to upwards of 2,500 video or telehealth visits a week. And in many respects, the strategy, or if you will, the tactics to deal with that, because it all came on to us very quickly with COVID, was to just do more of the same. So when Rebecca asked us, to get together and talk about some of the things that we think are really kind of game changing, digital health really came up, and so I've asked a couple of people from our advisory board, our research side of the Optum organization, to spend some time talking about the benefits and realizing those benefits in terms of digital telehealth and whatever nomenclature you might use. With that said, let me introduce Rob Linnander. Rob's a VP in our Provider Research and Advisory Services organization. He's done a number of implementations or consulting engagements around telemedicine. Also want to introduce Carol Chouinard and Amanda Steele. Rob, Carol, and Amanda will be driving the presentation. They've got excellent background and excellent experience in the provider organization, and specifically in the research around this particular topic. So I think the plan here is we will kind of talk through what our thoughts are with respect to this. I think the last 15 minutes or so we'll be taking Q&A, so please feel free to generate any of the questions that you have and send them in, and we'll address them time permitting. With that said, Rob, if you don't mind, I'll just turn it over to you. You can do your own introduction so I don't mess it up. But thank you again for joining us, and I'll turn it over to Rob.
Great. Thank you so much, Mike. And it's a pleasure to speak with everyone here this afternoon. As Mike mentioned, I'm Rob Linnander, and I serve as one of the leaders within Optum Advisory Services, which is a research-based consultancy. And what I think is important about that, a lot of the best practice foundations that we as we identify and we profile in institutions that we work with across the country and across the globe, so that we can really bring some of those insights to accelerate the performance of healthcare providers across a variety of different facets. And so I've been with Optum for the last 15 years and work with a pretty cool team. Amanda and Carol here as well. I'll let both of them introduce themselves. And we are individuals who serve on our Digital Health Center of Excellence within our consulting practice. And so it's a multidisciplinary group of individuals with diverse backgrounds that are able to really meet organizations where they are and bring to life strategies to not only plan and design what their digital health strategy should look like, to implement and install some of those different tactics and operational facets that are critical for success, but then also thinking about transforming and scaling, both thinking about that in terms of growth enablement, extending care capabilities and clinical benefits, and then also looking at it from an economical benefits for an organization. So I'll allow Carol and Amanda to both introduce themselves, and then we'll jump right in.
This is Amanda. Well, of course, we jump in at the same time, right? This is Amanda. Very briefly, I have the pleasure and privilege to work alongside Carol and Rob and Mike, really focused on this Digital Health Center of Excellence. From my vantage point, I get to spend a lot of my time focused on issues impacting providers themselves, as well as the operational intricacies of setting up these types of programs and then scaling them, recognizing that there are numerous modalities occurring simultaneously. So really looking forward to the presentation today and to your questions. And Carol, I hand it over to you.
Thank you, Amanda. Very quickly, Carol Chouinard, I lead our IT strategy practice. My background really is working with CIO or health system executive teams that are really interested in using technologies to enable their strategy. And I have been leading a number of these telehealth initiatives in the past few months, and looking forward to share more about that in a little bit.
Thanks, Amanda. Thanks, Carol. And so without further ado, we'll jump in and walk through the agenda for today. So starting out with really a state of the union on how virtual care has really been accelerated, certainly within 2020, but thinking through some of the economical implications, the regulatory and legislative implications, as well as how we need to really reevaluate the care delivery organization itself to fully take advantage of some of these different modalities and advantages that we're provided. Second of all, Amanda will walk us through really a playbook for virtual health and some of the key components and factors that are important for organizations to consider as they develop and enhance their plan, reimagining what's possible, but also now taking into factor different consumer and patient expectations, particularly from populations that historically haven't been able to benefit at scale from digital health, whether those are related to seniors and Medicare beneficiaries, since being able to leverage this at home was not a covered benefit. So we'll talk a little bit about that. And then third, we'll highlight some case studies and some best practices for both the deploying and scaling, and then thinking through moving beyond a rapid response. How do you look at this at digital health as an organization with respect to governance and long-term planning and the like, so that we're able to support caregivers and providers alike and patients alike. And then certainly, as we mentioned, some next steps. So without further ado, when we have looking in the past, prior to really March of this year, with respect to some of the public health emergency declarations, which have really allowed significant deregulation and expansion of virtual health services, we were able to evaluate through a number of different, whether it be related to some of the McKinsey reports, that there was a lot of innovation that was happening within the digital health space. However, the patchwork of reimbursement landscape, which had differences at a federal, state, and local level, and then also various benefit packages that were designed from health plans really slowed some of the adoption and the ability for organizations to invest in this at scale. And although there has been a steady uptick in digital health, when we really saw some of the most significant impact, it was certainly this year. And so, as Mike suggested, many organizations are doing thousands of daily visits, in some instances tens of thousands of visits for some of the larger organizations and providers across the country. And we've seen both as a means of maintaining business continuity and resiliency during the pandemic, but also thinking about patient and caregiver safety, also making sure that we're able to maintain connections and loyalty with patients so that when they need to come to the organization, that we can think about how to both prepare them, thinking through new tools and opportunities related to triage and wayfinding and different types of symptom checking, but also the actual delivery of care itself through whether that's asynchronous and portal-related communications or whether it's related to audio-visual or audio only, and then also other modalities, whether that be different types of online and screening and screening tools, as well as remote patient monitoring and other modalities. And so when we think about where we are today, digital health really has to be a core component of an organization's strategy. One, because of our ability to maintain care and think through our volume implications across the coming years, of which we expect to be impacted by some of the recent economic impacts from the pandemic, but also as a means of knowing that, as various parts of our country go through different oscillating waves and disease prevalence and instances of disease prevalence, telehealth is going to be really important for us to maintain reach and provide care to our communities. So when we think about digital health as a permanent fixture in healthcare moving forward, many organizations historically had pilots that they had deployed. We were looking at potentially inpatient intensivist services, our telestroke programs, because some of those modalities were certainly reimbursable, and they were instances where those pilots had gained some traction and general acceptance amongst the medical community, and were able to expand care delivery and quality outcomes for providers. In some instances, there may have been some application of televideo visits for urgent care services for certain patient types, but generally speaking, not necessarily widespread. Now, for organizations, telehealth is table stakes, and that organizations who now have to think about telehealth as, gosh, not only am I now thinking about my competitive landscape relative to peers, other healthcare providers that may be within my community, but I'm thinking about large national telehealth providers and digital health providers that could be practicing across the country. And so it's really important for us to think about ways to not only improve adoption at the provider level, but the patient level as well, and then thinking through the different applications of it as a benefit to each of our individual organizations. What we also see for patients is that now 76% of patients are interested in using telehealth moving forward, which is critical for when we're thinking about our intake and our access strategies to meet patients where they are and make sure that they understand the different vehicles and avenues from which they can receive care for each of our organizations. Also, some organizations are using the telehealth capabilities and digital health capabilities to prepare patients for their visits and appointments so that they're able to maintain a contactless and touchless experience when they arrive to minimize time in a waiting room and potential exposure, but also just offer that white glove service that's necessary for patients when they're navigating potentially a complex care setting. There are really 5 key pillars that we really want to impress on providers across the country and executives to think through relative to digital health. It is not simply an extension of the traditional care model, but actually we're talking about really 5 foundational components that are important to keep in mind. First, around growth, our ability to extend reach and access, both contiguous and non-contiguous access, such that we're able to benefit through providing new modalities, new services, and think about expansion and strategically. Second, we're able to talk about the patient and provider experience. One area that's particularly important at Optum, we track a data set which we refer to as the COVID Concern Index. And so what's nice about this panel that is surveyed every other week and has been since the onset of the pandemic is we're able to evaluate relative fears and apprehension and willingness for patients to re-engage with different healthcare settings at various points in time. We can look at psychographic, demographic, and other sorts of behavioral indicators to look at what their propensity would be to seek out services in a doctor's office or a freestanding emergency department or an ambulatory care center or inpatient care. And when we're looking at this, we're identifying the fact that over 2/3 of patients would still prefer to use digital health as a means of maintaining their safety, and not just because of some of the convenience factors that are associated with it, but that this is almost 70% of that would be women and 65% men. So really looking across gender as this is something that we see broad applicability to and something for us to keep in mind. The third is related to care improvements and the clinical benefits associated with digital health. What's important too is when we're thinking about certain types of behavioral health modalities, some organizations are working with their patients to complete some of the different types of screening activities that can be leveraged for both risk adjustment and and incorporated into the care delivery of those patients, both at and before the time of their appointments, using tablets or their smartphone or other types of capabilities that may be available. Additionally, we're able to use remote patient monitoring and other technologies and modalities to maintain connectivity with patients so that we can quickly intervene when necessary and work with patients on adherence to clinical protocols, medication management, and the like. The final two are really important as well. We don't want to lose sight of the economic picture, gaining efficiencies and reducing cost as the actual when we look at payment parity that exists now, and certainly through the expansion of the recent public health emergency for the coming next few months, we're also quickly looking at about 5 or 6 key pieces of legislation that are currently before Congress, which will impact the telehealth landscape in the future as well, increasing access, but then also looking at some of the different types of reimbursement implications. Certainly FCC rules as well. Broadband access will enable communities that may have historically not been able to take advantage of digital health because of limited technology infrastructure will also be able to now be under consideration as well. But from an efficiency and cost reduction perspective, telemedicine enables us to really rationalize and look at the length of the appointments, the types of the appointments, how providers are managing their patient panels, deploying different care delivery models, such as the virtualist model, so that we can inflect and bend and lower the cost curve, but also think through with the reach how we should model and evaluate some of the reimbursement implications. The fifth is around innovation. Digital health enables us to look at, gosh, there are tons of different, and if you look on the App Store today for Android or iPhone, you can look at all of the different health apps that are out there, literally tens of thousands, which all offer the benefit of tracking data, providing nutritional counseling or fitness advice, or also fertility guidance, also related to care management. And so there's a world that's out there. And so it enables organizations to think through the ability to leverage different data sets, different points of connectivity with patients, and then also advanced applications of machine learning and artificial intelligence to really think about how we can use this as a differentiator within our market, with our patients, with our providers and physicians across the organization. I think what is critical as well is that there are several challenges that organizations must overcome in order to really make meaningful gains and improvements with respect to digital health. The first is oftentimes we run into organizations that did not have a roadmap prior to the pandemic. They may have had an investment that they made in a virtual visit platform. However, that may have had marginal use, marginal adoption. There may have not necessarily been all of the different deployment across all of the different types of providers who could potentially be taking advantage of that. We know even just during the pandemic, our ability to use digital health for physical medicine, PT, OT, and speech therapy was something that was completely new. And so the strategies that organizations may have had in place prior to the pandemic need to be completely reimagined and refreshed in order to be effective. Second, the scarcity of digital health expertise. What I think is interesting even about our center of excellence within Optum is we have representatives who know the regulatory landscape, the financial landscape, the reimbursement and revenue cycle landscape, IT, physician enterprise services, so that we're able to think through all of the different service line models as well as the care delivery models. And so being able to amass the expertise and the stakeholder input for organizations is a particular challenge, recognizing that this hasn't necessarily been as widespread adopted in the past. And because there is such innovation, you'll see the Amazons and the other pretty large innovative companies, Googles that are and Alphabet that are making big investments in this. And so the competitive landscape for talent is pretty is high as well. And then on the right, you'll see that tight margins are really pressuring digital health to deliver. Given mass layoffs that we've seen and widespread unemployment, particularly within the provider community, it's really incumbent upon organizations to get this right. And the impact from every investment must yield outsized ROI in order for it to be deemed a success as an organization. And so we'll talk in a moment about not just these three critical factors that we need to overcome, but thinking through all of the different technology implications as we evaluate modalities, interoperability. We want to make sure we're looking at connectivity. We also want to look at the impacts on the provider organization and thinking about all of the different tangential components that are critical. And then also keeping pulse on the regulatory landscape. We often have organizations that will say to us, what are we going to revert back to if it's not payment parity? And the question is actually, and I think what we're looking and we're listening to CMS is that we don't anticipate there to be a full snapback, and that many organizations, particularly your Medicare Advantage delegated entities, are saying, gosh, this is a really effective tool for us to deliver, to ensure patient and population health. And so we're anticipating that while there may be some changes within the reimbursement landscape moving forward, we will certainly continue to see, we won't see that revert back to sort of pre-COVID reimbursement. And so that's one thing that we're working with a lot of organizations to model and to think through, also balancing the state legislations that many organizations pass to achieve payment parity, but then also thinking through the other implications for some of the legislation at the national level. So with that state of union in mind, what I'll do is actually turn it over to my colleague, Amanda Steele, who will walk through some of those key components when formulating your digital health playbook and reformulating, in many instances, ideas, tactics, and strategies to keep in mind.
Thanks so much, Rob. You know, we're spending a lot of time with organizations currently thinking through what level of investment they should be making now and what level of investment they should be making into the future relative to digital health. And it's difficult now because we are both really serving the population that needs to be served currently, but also thinking about how do we transition many resources that have, for the most part, been designed on an inpatient side to now cover the outpatient business as well. We actually had the opportunity to speak with a very large system a couple of weeks ago who essentially said to us, you know, we woke up one morning and said we had to do a complete 180-degree pivot. All of our resources were focused inpatient. We now have to look at the outpatient world. So it just gives you a sense of this is where a lot of folks are spending their time right now. It's not the same answer for everyone, but there are some really key imperatives for moving forward. The first is we really do have the time now, and organizations that I think want to leverage this to be market competitive or gain competition or growth in their market should be prepared to move fast and with purpose. There is a lot of ground to cover, but it's ultimately going to help drive, as Rob indicated earlier, your overall margin sustainability and the outcomes of your patients. what we strongly suggest for organizations is they work on developing a digital health blueprint. We're going to talk a little bit about what that looks like. Many organizations certainly have already embarked on strategic plans for telehealth or other virtual health services. We hear a lot for remote patient monitoring or other types of services. But this is really the opportunity to put those pieces together. We also recommend organizations thinking about the populations they serve relative to digital health. And we are going to talk a little bit about today, too, from an operational perspective. A lot of this has to do with segmenting who your patients are, who your consumers are, and how they want to interact within a virtual healthcare platform. It's going to be a little bit different for everyone. And we do think that the organizations who are going to be most successful in leveraging digital health are those who are going to customize the look and the feel of it for their patients. And then trust us, this is not about doing any of this on your own. Partnerships are going to be the name of the game here, whether they be in terms of your technology platforms, in terms of how you are using other types of providers, in terms of your physician alignment, and lots of things in between. So no, there's a number of pieces to be aware of. And so what we think about here too is it's not a side of the desk job. Digital health, digital and virtual care is really going to be an opportunity for organizations to call together all of these perhaps siloed different parts of your organization and recognize that a unified strategy and a unified approach to digital health is going to be one that's going to enable you to move fast, to move furiously, and to really impact your system. Let's move on to the next slide. And so we really think about digital health as a multidisciplinary practice. And we only have 5 pieces on this wheel here, and I'm sure there are others. But the broad strokes of it here are your finances, your technical side or your technology, incorporating your clinical work, thinking about the operations, and then ultimately leveraging all this to be transformational. We often see with organizations that they have previously approached digital or virtual health from one side of this coin. We've certainly worked with a number of organizations pre-COVID who said, I may or may not be interested in virtual health because my state doesn't reimburse it, or because the laws are different state by state relative to who can actually practice and what that actually means for us. From an operational perspective, I've certainly been with many a physician who shared that they just didn't like practicing in that mechanism. It didn't make sense as part of their practice. For patients, it was the same thing. On the technical side, my goodness, we're thinking about interoperability. We're thinking about all of these different technologies. We have to stand them up. We have to get them integrated. And on the clinical piece, this has to really advance the quality standard, the standard of safety that we are setting for our patients and for our systems. For organizations who are really proving to be beyond comparison when it comes to digital health, they are organizations who are thinking about these things cohesively. They are not setting up separate infrastructures to deal with all these pieces. They're really thinking of digital health as a number of different modalities where the physician and or the patient interact with one another. It might be synchronously, it might be asynchronously, but we need to really blend together all of these really important layers of expertise and advance a new type of system and a new type of care delivery that's going to enable us to be really dynamic and flexible. I think what many organizations have learned in the last few months is just how flexible and how dynamic they can be. We saw organizations do absolutely amazing things, whether it was moving from 5% capture of virtual visits to 95% capture of virtual visits almost overnight, setting up huge technology infrastructures that folks originally thought could only be done, in 6 months, 12 months, or an 18-month implementation cycle. Organizations really, I think, blew us away in terms of what they were able to accomplish. We need to keep that theme and keep moving forward, keep all of these pieces integrated so that we can do the transformational piece. And that's what's going to enable us to leverage digital health as a growth mechanism to disrupt markets, to disrupt market share, to actually inflect the cost curve, leveraging digital health, and accelerate many organizations' ability to take on and be successful in value-based care. We can move on to the next slide. Like I mentioned before, segmentation is going to be the name of the game here for many organizations, especially in a state like Minnesota, where you can have lots of different geographies within a single system. Your patients ultimately interact with your providers in different ways. We should expect that they're going to interact with virtual care in different ways too. And so it should be really part of all of our journeys to recognize that these modalities need to empower our patients. They absolutely need to improve the care delivery journey, and they need to enable providers to do things they weren't able to do previously. These systems enable patients to really take control of their health. And so there's going to be new opportunities for education, new opportunities for different types of contact with our patients that keeps them within our systems, keeps them within the care continuum, so that we can really keep our eyes on the quality of care and how they are doing. I'd also note that, this is truly an opportunity to engage your physicians and your advanced practice providers in a different way. We heard from many physicians during the last few months about their real excitement for telehealth and digital health services as both a mechanism to interact with their patients, recognizing that they really could deliver high quality care and in many cases the safest care virtually. But it's also a way to engage your providers in thinking about, how do I cull burnout within my physician practices? How do I do things that lessen their administrative burden? How can I, manage their schedules to alleviate what might have been feeling like a very busy time, but I'm also being able to see those patients the way that they need to be seen to maintain our volumes. So a lot to be done here from an innovation standpoint, and certainly an opportunity for our physicians to be at the table driving these conversations and really showing us what digital health can do. Move to the next slide. What we reference often, both Rob and I and Carol will too, is this idea of digital health as a modality. There's lots of different ways to interact with digital health. It's not just a program that's running concurrently to our program of visits within the clinic or visits within the hospital. And so there are a number of different mechanisms that we're encouraging organizations to consider about how they, as a service line, how they, within a care model, really interact with digital health. From a pre-service perspective, that might be what an organization on the West Coast we're working with is doing is for all new patient appointments, before they have their new patient appointment in the office, they're having a medical assistant do a visit with the patient via a telehealth platform so that they can do all of their intake. So all of that is done before they get into the actual office building, really meaning that they can accelerate the turnaround time in the office building. They can make it more safe because they have less people in the waiting room, and they can pre-screen all of that material so that the physician is aware of what's going on and can really work through that visit quickly. On point of care, the tele video visits have been quite critical in terms of their decision making. What we are seeing in terms of the rapid rise of technology in this place for point of care is just astounding. I can't wait for 6 months or 18 months from now to think what we're really going to be seeing in terms of at-home vitals and just different types of technologies we're going to all be able to use and interact with from a remote patient monitoring perspective. So really cool things on the horizon there. And then post-visit, it's not just the maybe once in a while email from a patient portal anymore. We really have the opportunity to remotely monitor our patients, understand their care plans, keep them well, and keep them engaged in a way that we haven't been able before. And so with that, I'll turn it over to my colleague, Carol, who's going to speak a little bit in terms of our lessons for success.
Thank you so much, Amanda. Rob, we can move maybe to the next slide. I have really 5 slides to share with you, and I just as I've been listening, there's a lot to be thinking about in what Rob and Amanda have been sharing. And before I share even more things to keep in mind, I just want to share that for most of us and who have been in the industry and have been implementing IT for some period of time, a lot of these questions really are similar to what we have been in the past. I think there is really a new era in terms of the technologies that we are working with that are enabling what we want to be doing. But it's still the same guiding principles that really it's about changing the way healthcare system, working on improving their healthcare system and using all new technologies for doing so. But really the considerations are really around care delivery, around health system operation or ambulatory care operations, around all of the financial impacts associated to it. So that's going to be consistent as well in some of the things that I'll be sharing. I'll be sharing a little bit of our experience just to share with you what we have had the opportunity to do in the past few months. I'll share a little bit of kind of how we some of the lessons learned on how to go about it. I'll share about a few thoughts on what it takes, and then I'll share some thoughts on what it means going forward really in the form of a number of questions that we get to discuss or we get to ask a number of organizations we've been interacting with. So this first slide is probably what I assume is reflective of one of the largest telehealth initiatives in the country in the past few months. As you probably know, our colleagues from Optum Care is a large organization. Optum Care is a network of where close to 50 or over 50,000 physicians are participating in different regional care delivery organizations. And a number of them had been using telehealth in the past, but really as the pandemic hit, really we were tasked to help them with really a very rapid implementation and deployment of telehealth capabilities across all of the networks. So you see some of the numbers there, over 10,000 providers that have been onboarded. That's really in addition to another 5,000 to 7,000 who were already using telehealth in all sorts of capabilities, right? The initial driver was around Medicare Advantage and continuing managing gaps in cares, but really it's been expanding to all sorts of specialties, including surgeries, emergency care, etc. That just illustrates really the scale and the rapid pace of implementation that we've seen, not just within Optum Care, but across the industry in the past few months. Some of the thoughts that that I'm going to share also is based on some of the recent EHR implementation that we have done, some of the recent engagement that we've had specific to helping our clients really managing Medicare Advantage plan or risk-based contracts, or a number of more broadly enterprise strategy where a lot of our health systems colleagues really are wondering what's going to be the new normal, how they should be adjusting, and where would telehealth and digital health fit in the bigger picture. So just wanted to share some numbers here and past experience. If we want to move to the next slide, please, Rob. Here, the key message really is that it's been a journey, not to repeat what Rob and Amanda have shared in the past, but definitely pre-pandemic, it was especially telehealth was there, but with what I would call a slow progressive adoption, and the world has changed very, very drastically. So when we say the world has changed, really it was a mix of these regulatory changes, the need for really all of the clinics and hospitals to change the way they do business, just in terms of business continuity, just in terms of continuing to serve their patient. What we've seen is that in the process, really we have collectively created new expectations on how patients could interact with their providers, and new expectations in terms of what are the different tools that providers can use to interact and deliver care to their patients as well. So these expectations definitely are there to stay, and these new capabilities will continue to be in the portfolio of that's available to them going forward. We want to move to the next slide, please, Rob. Here, the key message is that it takes a village. Although when we use the term telehealth, most of us have kind of a box that defines what telehealth is. In most cases, where our personal boxes, the way we see it, really probably is not inclusive of all of the aspects that telehealth represents. So again, Amanda and Rob have touched on it. There's definitely a care delivery component. There is an operational component down to workflows and access to data. There's definitely a financial and revenue cycle component, but there's also a technology component. And what we've seen in the time of crisis was that all of these capabilities really were needed to support the rapid deployment. So what we've seen and what we would recommend, even looking back, that we would use the same approach in making sure that we have either resources or expertise in each of these areas as we go about the rapid deployment. The adoption and experience in particular is probably one of the common themes of one of these areas that have been, I tended to say, neglected by a lot of people already, as we were in a crisis mode and we deployed a lot of these technologies without taking the same time that we would normally take really to understand the impact, the experience, the limitations, both on the patient and on the provider side. So we're now definitely in the mode of looking at all of these capabilities and looking at what it means for the future. But the key message here is that all of these capabilities really are needed to have a successful telehealth and digital health implementation and adoption program. If we want to move to the next step, a little bit in terms of the how here. And I'm going to basically compare and contrast what has been done even in a rapid mode and compare that to what we would normally do. First and foremost, as we talk about telehealth, as we talk about digital health in general, going back to what I was just saying, although it's broad and complex type of implementation, really the experience is really personal, and personal down to really the patients and the patient conditions and the type of services, the type of care they need to receive, really down to their specific condition. The same on the provider side. Has just been an incredible learning experience for me anyway, as we work with our Optum Care colleagues to realize to what extent there was a diversity of models for engaging physicians. So some physicians are employed, others are part of IEPA, others really are part of joint ventures that really are tied to the larger provider organizations. So just in terms of navigating through the contractual aspect, the financial aspect from a contractual, not just from a reimbursement perspective, has been hyper complex. So for a lot of you who work in a health system, especially as you start kind of exploring the collaboration between health systems and the different ambulatory bodies, organizations working, collaborating with your health systems, there's just an incredible diversity, and definitely that has an impact on how these solutions are being deployed, who's paying for it, who is allowed to pay for it, not just during this period of crisis, but what's going to happen on an ongoing basis. So the experience is personal, and when we say experience, we tend to think about kind of feature and functions and user interface. We're really talking about experience all the way up to really the contractual, the decision-making process and how people engage in developing these structures. The rapid deployment really was a good test for applying the judgment on what are these traditional best practices that needed to still be in place. So security, for example, the availability of data, and really all of the kind of the training and the usual adoption activities that we go through as we implement new technologies. But there's a lot of activities that we would have normally done, kind of due diligence on some of the vendors, for example, really is something that definitely most organizations have not had the time to do as we would normally do. So we find ourselves in that situation where we're coming out of a rapid deployment, and we want to make sure that all of this, that we bring all of this, we transition toward really a long-term, sustainable, permanent model where all of these compromises that we may have done in the past few months really are being addressed, and that they are part of the transformation journey. We can move to the next slide, please, Rob. Thank you. Here, what we wanted to do really is just share with you as we interact with a lot of healthcare organizations who have gone through this journey in kind of, again, rapid deployment, looking at what's ahead. A number of these questions and considerations that keep coming back, and for some of us who have been around these types of deployment for the past few years, there may not be something new, but they brought to the surface, they further highlighted some of the complexities associated to implementing telehealth programs. So probably to me, the most important one is to understand where it fits in the organization. So you'll see I'm not following exactly the same questions that are on the page, but where it fits in the organization, i.e., are we just trying to be defensive and try to continue generating revenue and serving our patients during this time of crisis, or are we really thinking of this as a transformational opportunity where we're going to use these technologies to further integrate and collaborate between acute care and ambulatory care, and we are going to introduce really new ways of approaching the business. So we've seen organizations launching virtual hospitals. We've seen organizations launching initiatives specific to access, for example. We've seen a lot of organizations who are focused on who have done the transition from fee-for-service to value-based care, really leveraging these newly deployed tools as part of their broader transformation journey. So going from a defensive a response to the crisis to really accelerating a journey, a transformation journey that may have been in the works, or that may have been really that they may have been thinking about for some time is definitely what we see. Where the question is, where does it fit really in the broader plans? The other question is, how do organizations get organized around it? So there's definitely a major challenge associated to the fact that it takes a village, right? So most healthcare systems have kind of traditional organization. You have the technology, you have revenue cycle, you have finance, you have the clinical leadership, etc. And that's been definitely one of the challenges in the past, is to find the right the right organizational model, the right model to drive these things forward. Organizations who have either digital health leaders or transformation leaders, a lot of times they can bring everybody together, but it takes really a leadership that's more than a committee that is just a collaboration. It takes someone who will have really the power to develop a roadmap and to have kind of bring the resources that it takes really to make it happen. And maybe the last point that I'll make on this one is really having a good sense for where it's all going. So especially in large systems where like maybe 5, even 10, in the case of Optum Care, it's probably up to more than 10 different telehealth platforms that have been deployed in the different regions. Really having a plan for how to bring it back together, having a clear idea of how all of this is going to be integrated, your EHR platform, your other technologies, all of the analytics technologies, other digital health tools that you may have had deployed already in the organization. How will that all fit together in 3 years down the road and 5 years down the road? Making sure that we bring all of the activities under a roadmap that's leading to a clear roadmap is absolutely key in the current context. Next slide, Rob, please. Already only 8 minutes left. I'll just conclude by saying that I'll make a couple of quick remarks, and Rob, Amanda, I'll invite you to circle back as well and share some closing thoughts. But I think what I'm hoping you got away from the discussion today is that there's a lot to think about. It needs to be an integrated effort, but it's really no different from other really enterprise transformation that from a technology perspective we've been part of in the past. In the notion that it really takes a village, but the value of having a partner who have kind of been there, done that is definitely key in this situation, as most organizations get caught by if there's 20 different capabilities, if there's 1 or 2 missing, that's typically where the risks are. So having a partner who can provide all of the different capabilities to complement your team is definitely the way to go. Rob, Amanda?
Thanks, Carol. Organizations evaluate and design and prepare to really transform their organization with digital health. We think about a maturity model and a maturity curve that often helps organizations to think about kind of where they've come from and where they want to go, so that they can evaluate where investments and prioritize. So when we look at maturity, we're factoring in the various types of modalities that may potentially be available for digital health. We want to look at the various types of strategies to improve adoption by patients and providers, and thinking about that at the service line level to how deeply embedded and ingrained are we within each of the service lines. But then there's certainly all of the operational components and configurations that are really important for us to design to take full advantage. Some of those types of operations are, how are we reconfiguring our contact centers to educate and support patients with accessing the portal and pursuing refill requests and communications and messages to their providers? Or how are we using that to train and educate patients so that when they enter into a virtual visit, they don't spend the first 15 minutes of that trying to figure out how to angle the device or the phone, and so that the time with the provider can be well spent. And so there are some of those really technical in the weeds pieces that need to be worked through as well. And so I think having an understanding of all of those components is really critical. So thank you, Carol. We also wanted to make sure that we had plenty of time for questions, and with about 5 minutes to go, I should say. One question has been provided to the group, and we encourage others, please feel free to use the chat feature. But the first question, and I'll turn it over to actually my colleague Amanda Steele to answer, is what clinical areas today do we generally see with the most volume for telehealth, and what clinical areas do we foresee as being most likely for development and growth in the future?
Thanks, Rob. It's an excellent question. And so talk a little bit about what we're seeing right now. And I think that ultimately depends on from what lens you're looking, and then where we're encouraging organizations to look to the future. I think without surprise, the most volume, especially as we've turned to the outpatient side in the response to COVID, has been in primary care. I do not think that that's going to change, and I would tell you that there is a significant amount of innovation that's been ongoing in primary care relative to non-traditional types of providers really becoming market entrants. I would anticipate that there would be additional market entrants and larger market entrants from that perspective coming in and out of the pike over the next few months and few years too. Next to primary care, behavioral health has just been transformative as it relates to the delivery of telehealth and digital health services. That said, where we are really encouraging organizations to think through are to two other places, one of which, of course, is your chronic care populations, and thinking about how do you embed digital health to help your volumes or help your patients within the continuum. So for example, how do you leverage digital health, remote patient monitoring as part of your diabetes patient management? That's really going to help your patients in the long run, and also going to help those physicians who are treating patients to be able to look at their volumes a little bit differently, so that they can, again, segment their populations and segment who they're seeing. The other piece of that is really thinking very strategically about the types of visits that are coming in, particularly on the specialist side. And what I mean by that are, for programs where you have bundles, or, for other types of programs where you might see a patient, maternal fetal medicine is a really great example, numerous times within the office, where the visit could be done via a virtual platform, and you're not actually incurring any additional revenue for that visit. It's part of a bundle. I really think that that's going to be a key place for organizations to think about clinical service delivery in a different way. And that's truly going to be a place where organizations are able to inflect the cost curve.
Rebecca, were there other questions that came through?
Yep, we have one more. How are organizations marketing this to patients to improve the acceptance beyond COVID?
And I'm happy to take that. There are interesting case examples. I'll point to Rush University in Chicago, who's been doing some pretty interesting types of patient communication and outreach throughout this process of the past few months. In order to maintain connections and personalize messages to various patient segments. So typically what they were finding was through many of their traditional patient outreach, they were getting a less than a 1% hit rate or click-through rate to be able to guide those patients to a particular desired action. That might be, a general blast about different types of services or capabilities around telehealth. And so what they found was when they were able to segment and personalize the messages, so we could take patients that had particular types of conditions, map those conditions to content that would be relevant for those patients. So perhaps I have high blood pressure or diabetes. We can include different types of video segments or clips on how to manage my conditions. There might be a section for patient recipes. There might be information on how to stay healthy, or to create my online portal, or to message my doctor, or to manage my medications. But there might also be information on how to select a telemedicine appointment. And then oftentimes these messages are also embedded with content that may be provided from a physician or a practitioner or a leader that patient may look up to, so that it helps to curate the content that is going to guide the patient to the most appropriate response. Some instances that's activating them to come in for care. In other instances, it might be to stay away, but choose the delivery method that's most helpful. But that curation of messages is really important. And I mentioned sort of the COVID concern index and some of the consumer survey work, which is really important to know by segment and by population within each of our different markets, what's going to resonate and what type of concerns or issues do we need to address within our messaging to those patients. But the targeted patient outreach has been quite successful. And at Rush, they actually were able to, within some of their select deployments for OB services and women's health, they were actually able to increase that response from less than 1% to 17% for some of their various types of targeted outreach. So I think it's really all about the personalization.
Great, thank you. Thank you to Mike, Rob, Amanda, and Carol for presenting today. Thank you to our members for attending. I would just like to encourage you to please look for future webinar events out on our website at mn.kimschapter.org. Thank you, everyone.